Joined by President and CEO Brian Dietz, I'm Patrick Osterman. Welcome back to another edition of MDH Minute. School's back in session. We want to welcome area students back, and we wish everybody a very safe and a very healthy school year. Brian, we do have an update on the MDH Drive-Thru. August 27th through the 31st, we will have a temporary location. It's going to be a tent right near the Westervelt House, a nice, very nice temporary tent. But you're going to be doing some work on the concrete floor inside the drive-thru, and that's the reason why we got to relocate for 5 days. Tell us a little more about the work that's going to be going on inside the MDH drive-thru.
Yeah, concern we had when we poured the concrete was how long the concrete would last with the amount of traffic we have to go through. You know, we've had up to 185 cars a day go through there, so you get a lot of wear and tear on the concrete. So Adrian and I went over to NTN Bauer and did a walkthrough in their plant. They have a lot of vehicles that transport product throughout the plant, and they've had a challenge also of trying to maintain floors. And so we thought initially epoxy floor would be a good floor to put down on top of the concrete to preserve the integrity of the concrete. But they taught us that there's a whole new flooring that they found that works much better than epoxy. So we're going to apply that this weekend, and it takes several days to prepare the floor to actually put down this finish. But it will last guaranteed for 20 years, and it's not going to allow any more damage and it will maintain the integrity of the concrete floor. So we're really excited about it. We couldn't do it immediately when we finished pouring the concrete because the concrete had to cure and you had to wait so many months before you could do it. And so this will be much easier to clean. It's much more durable. And the folks at the plant were very convincing that if we're going to do this is the material we put down. So we're pretty excited about it. So it's going to be a 5-day disruption, but yet that should be the last time we have to close down the drive-thru for any reason at all.
So in order to do this, we had to have a temporary tent located, that, as we said, right near the Westervelt House. Special thanks to Edgar Rodriguez, McDonough County ESDA director, but as of recently, also now employed part-time by MDH.
Yeah, we're really excited about that. We've worked a lot with Edgar since the beginning of COVID, so we've gotten to know him real well, and he's gotten to know us real well. We've hired him on board for 24 hours a week for emergency preparedness work that we have here. He also has a unique gift in terms of being able to access federal resources through his ESDA role with the county that we can't access. And so we've taken full advantage throughout this whole pandemic of accessing resources through Edgar and what he has available to him to enable us to do a better job with what we have here. And he was the one that brought the tent out. He helped us get the first tent. He's just been hugely instrumental at giving us the capability that we need to do what we do the best way we can. But that's a huge success story for us too, because having Edgar on board just gives us that much more capability.
Well, we want to welcome Edgar to the MDH family. Brian, staying with the COVID theme, we've seen an uptick in cases during the month of August. Our inpatient census of COVID positive patients has increased some, but we still have bed capacity.
Yes, we have plenty of bed capacity. You know, we're still licensed for 48 beds. What we are seeing, though, as everyone else is an uptick with the new variant. We're having more inpatients now than we've had before. In fact, we've had more inpatients the last 4 or 5 months than we did all last year. So, but the difference is we have the drugs and the cocktails we're offering patients that every other hospital is as well, where people are getting well. You know, so, and then the elderly who are most vulnerable to COVID are getting vaccinated at much higher levels than much of the population. So we're not seeing the kind of death rate that you would normally, everyone feared early on with COVID. People are coming in, they're getting well, and almost all of them that are coming in are non-vaccinated. And there's a real message there. Yep. So we really want to encourage people to get vaccinated. Our hospitalists have told us there's been a number of patients that have come in with COVID, obviously not feeling well at all, which is why they have to be in the hospital, and have been insistent on getting the vaccine right away, and you can't do that. And so there's a waiting period you have to go through before you can be available to get the vaccine. And so people are learning, unfortunately the hard way, that this really is something to take seriously. And that you can get very, very sick when you pick up COVID, particularly with this new Delta variant. And so, we encourage people to get vaccinated. That's the answer. And it's not a surprise that the patients we're seeing, almost all of them have not been vaccinated.
Speaking of COVID vaccines, earlier this week, Pfizer received full use authorization from the Food and Drug Administration. Hopefully that's going to persuade some people who've been still debating, sitting on the fence whether or not to get a vaccine. Hopefully this will help them make a decision to get vaccinated.
Yeah, that's our hope. And Moderna submitted their final paperwork earlier this week to get their FDA approval as well. So our hope is within the next month or two, all the relevant vaccines we want to have for boosters and for follow-up will be FDA approved. We had a great meeting. We meet regularly with the health department and the university to talk about planning for future COVID vaccinations and the boosters. So since the availability is going to be far better than it was at the outset of COVID in terms of accessibility to vaccines, we have many thousands of vaccines now in storage here at the hospital. We do that in conjunction with the health department. We're putting together a plan now for the county to actually do mass vaccinations and mass booster clinics. And so I would suspect in the next 2 to 3 weeks we'll get all that information out so that people will know what the procedure is going to be this go-around, which will be vastly improved from the first because the availability of the vaccines is not an issue this time. And so we can actually plan out a schedule that we can rely on and commit to because we won't have in question whether we'll get the vaccine or not.
Correct.
So it should make a big difference. We have made it so widely available that the only reason why someone has not been vaccinated is they choose not to. Early on, we heard a lot of people say, well, I don't know where to go, I don't know what the plan is, there's a lot of questions out there. Well, all those have been answered, so there shouldn't be any reason why anyone in McDonough County who's not vaccinated can't get vaccinated if they choose to do that. The hospital, we're really pleased. We're almost at 80% with all of our employees, which is huge. Much higher percentage than most hospitals in the country. And as we've talked to businesses in our community, it's much higher percent participation in our businesses. So yes, we'd like to see everyone vaccinated, but 80% is a big deal. And so we're really pleased with how everyone's just sort of stepped up and done what they can to get vaccinated. And I suspect they'll get higher as time goes on.
We just announced yesterday there will be a mass vaccination clinic Thursday, September 2nd, out at the old Farm King building. We'll be doing it in conjunction with the Medina County Health Department. All 3 vaccines will be available: Moderna, Pfizer, Johnson & Johnson. It's going to be from 9 a.m. to 7 p.m. Click on MDH.org or MDH Facebook page or social media channels for more information. Brian, we're approaching flu season. That means we're going to start doing flu vaccinations. And one nice thing about the drive-thru, as we mentioned earlier, how great that facility has been. Once again, we're going to be offering flu vaccines through the drive-thru certain days and times of the week.
Yeah, that's a huge advantage. The drive-thru gives us the luxury of being able to offer services regardless of what the weather is outside, whether it's incredibly windy, rain, sleet, snow, it doesn't matter. And so I know Wanda's been working with her team and certainly with the lab personnel to ensure we have the right personnel there to not only for the flu vaccine, but also eventually for COVID vaccines. We have the right people there, obviously, for the COVID testing and for lab draws, but it takes a different skill set to actually do the vaccines, and so we have to make sure we have proper nursing coverage out there and what have you. So the goal being with our drive-thru is to offer all services that lend itself to a drive-thru delivery modality year-round. And so we're building toward that. The COVID screening tests started. We're now doing a lot of lab work. That continues to go up every month. We're going to add flu shots, and eventually we'll have COVID that people can just get their COVID shot when they go through.
Great feature to add for the MDH Drive-Thru. Brian, we want to thank you for taking time out of your day today.
Thank you. It's a pleasure.
For Brian Dietz, I'm Patrick Osterman. This has been MDH Minute.